Menopause. So many women are suffering in silence. Why is this subject still such a taboo thing to talk about? You know, so many women are uncomfortable talking to their providers about menopause. So many providers are not experienced or educated enough to talk about the subject in its entirety. As you know, menopause is not just about hot flashes. No one's talking about the lack of libido or the lack of sexual interest, the fatigue, the emotional changes or mood changes, vaginal changes, the weight gain or the inability to lose weight, or the hair thinning, or the joint pains, or the fatigue, or the brain fog. It's time we start talking more about menopause and understanding some of the symptoms. So that's what my goal is today. We're gonna talk about it. So this video is not just for women over 50 or women who actually are going through menopause or have gone through menopause. This video is for the younger women so that you know in advance what to expect and what kind of questions and concerns to raise with your doctor or to raise with your medical provider. But also for men as well that has a sister, a wife, a female co-worker, or anyone important in your life that happens to be female, because it may help you understand what most women are going through or will go through. For anyone who's new here, my name is Habiba Tunau. I am a US trained and licensed medical doctor, but also a content creator. And besides doing lifestyle videos, I also try to bring educational content that might be medically related. So I hope you enjoy this video and welcome. So what exactly is menopause? When we say menopause, what does that mean? I tend to think of it as a transition, but the definition really is natural menopause is the permanent cessation of your period. So when your period stops permanently, it is considered menopause, assuming there is no medical reason for that cessation. In other words, that your period stopped and you did not have or you don't have a medical reason such as a thyroid or endocrine reason for your period stopping. And this amenorrhea or lack of period should be 12 months, at least 12 months. So if you have not had a period for at least 12 months and you are a healthy woman, biological woman, then you are in menopause. 95% of women will go through menopause between the ages of 45 and 55. And the median age in the United States is 51.4. So you might stop your period younger than 51.4 or older than 51.4. But on average, by age 55, you have stopped your periods. I apologize in advance if I'm sharing information that you may already know, but I like to assume that anyone watching this may be at a different level when it comes to their medical knowledge, right? You can see your ovaries are small oval-shaped glands located on either side of the uterus, and your ovaries produce and store eggs. Your ovaries make hormones, estrogen and progesterone, right? And that controls the menstrual cycle and pregnancy. Each of your ovaries has thousands of ovarian follicles. Ovarian follicles are small sacs in the ovaries that hold immature eggs. Each month, follicular stimulating hormone, or FSH, causes the follicles in one of your ovaries to mature. At day 14 of the menstrual cycle, or mid-cycle, you get a sudden surge of luteinizing hormone, which then causes the ovary to release an egg, ovulation. The egg travels down the fallopian tube to the uterus. So your ovaries continue to release an egg with each menstrual cycle until you reach menopause. So during menopause, your ovaries stop releasing eggs. Another way to look at menopause is that it is a reflection of the complete or near complete ovarian follicular depletion. So your ovaries have follicles on them and they are now fully or near fully depleted. Ovarian follicular depletion low estrogen, and elevated follicular stimulating hormone. So that is another way to look at menopause. A significant difference between a biological male and a female is that a biological male can continue to produce sperm well into their old age, right? They can continue to produce sperm into their old age, whereas a female, biological female, is born with a defined set of eggs. So when a female is born, all the eggs she will ever have in her lifetime are already present. And those eggs will stay dormant until she goes through puberty, right? And every month, she will lose one of those eggs with her period. And by the time a woman is 30, the quality and quantity of those eggs will have diminished significantly. Before we talk about menopause versus perimenopause, here's some interesting facts. Did you know the size of your ovaries are dependent on your age? Sometimes they can be as small as a little bean, and other times they can be as large as a kiwi fruit. So can you guess? Are your ovaries larger when you're older or larger when you're younger? Yep. They are largest when you are younger. So by the time you turn 30, your ovaries actually start to atrophy or get smaller. By the age of 30, your ovaries start to shrink in size. So typically women who have gone through menopause or many years out of menopause, their ovaries are very, very small, closer to the size of a bean versus the size of a kiwi. A big takeaway is that during menopause, your ovaries stop releasing eggs and stop producing estrogen. And that is one of the significant reasons why you get all these changes related to menopause. So for many women who have children, or women who wanted to have children and just waited too late, or women who just couldn't have children, going through menopause can be a very difficult stage in life. It can be a very emotional thing to realize you can no longer bear children naturally. So I mentioned earlier the median age of menopause, or the median age of your period stopping, is around the age of 51. So what is early menopause? What does it mean when someone went through menopause early? You know, what is early? Well, early is if you have a permanent cessation or stopping of your period before the age of 40, right? So if your period stops permanently for more than 12 months before the age of 40, that is premature menopause or early menopause or primary ovarian insufficiency. It's very important to let your doctor know if your period has stopped and you are under 40 years old, because early menopause is associated with an increased risk of cardiovascular disease, bone loss, and also some cognitive issues. Now, what is perimenopause? Perimenopause. Well, perimenopause is that transition period between menopause and during your fertile years. So menopause and your fertile years, there's a period of perimenopause before your period actually stops. A common symptom of perimenopause is actually hot flashes. So you can see hot flashes or experience hot flashes not just during menopause or after your period has stopped, but you may start experiencing hot flashes during that perimenopause period. You might also experience a change in your cholesterol or your lipid profile. Bone loss also occurs during perimenopause. There are a lot of fluctuations in your hormones, a lot of variations. You might see your follicular stimulating hormone become more elevated. Sometimes it may come back down to normal. You might also see your progesterone level, which is also important to fertility. That may also start to decline. Your estrogen levels may start to decline. So all of these changes are going to happen during the perimenopause period. A lot of fluctuations, which explains sometimes why you feel different, or why you may not quite feel yourself. You may have some significant mood changes or changes in the sensitivity of your breast. Also during perimenopause, you may notice a change in your menstrual bleeding. It may start to diminish over time. It may become lighter over time, and in some women it actually starts to get even heavier. So you may definitely notice a change in the way your flow happens. You will also notice during the perimenopausal period that your periods become irregular. So again, perimenopause is that period that happens between your reproductive years and during the years when menopause actually happens. That period in between is called perimenopause. So you still might have a period, but you're not as fertile as you used to be, right? And that period of perimenopause is usually 4 years on average. It's usually 4 years before your final period. So for 4 years before your final period, you are considered perimenopausal. And it's almost impossible for many doctors to predict when that period of menopause is going to be. So no one can actually tell you on this particular date or time you are going to stop having a period or you are going to go into menopause. But looking back retrospectively, we can say that 4 years prior to your final period was the period of perimenopause. The median age for menopause, as I stated earlier, was 51.4 years, 51.4 in the United States. So what affects that age? Like, why is it some women go through menopause much earlier than others? You know, why is it that it's not unheard of for you to hear women having babies at age 49? Why is it some women, you know, still have a period much later than others? As I stated earlier, as you get older, the quality and quantity of your eggs is significantly diminished, right? And so your chances of getting pregnant as you get older is very difficult, but not impossible. So anyway, what affects the timing or the age at which you go through menopause? Well, number one, genetics. Genetics have a lot to do with when you go through menopause. If early menopause is something that runs in your family, then chances are you're probably gonna go through menopause early as well. So look at your sisters or your mother and your grandmother, and that can help you determine when you're gonna go through menopause. Smoking. Yep, women who smoke may go through early menopause 1 to 2 years earlier than other women who don't smoke that are about the same age and similar backgrounds. So smoking affects how early you go through menopause. Ethnicity may also affect when you go through menopause. There are cohort studies out there that show, for example, that Hispanic women, when compared to white women, go through menopause sooner or earlier, and that Japanese women go through menopause much later than white women. I also found it interesting that night shift work, basically working long hours overnight, also affects when you go through menopause. A study with over 80,000 women that were over the age of 22, and it was found that night shift work is known to have an adverse effect on reproductive health and increases the risk of earlier menopause. I also found it very interesting and important to know that the year leading to your final menstrual period is the year when you have the most significant bone loss and also the increased risk of cardiovascular disease. So that's why it's important to know when your final menstrual period is, and to, you know, make sure you discuss this with your medical provider when your period stops. So question, do most women go for a test, or do you need a test to tell you whether you're going through menopause or not? No. Most women don't need a blood test or a specific test to tell you whether you're going through menopause. Typically, based on your history, based on your age, we can tell whether or not you're going through menopause or whether you're appropriately at the age for menopause. But of course, there are women who might be very concerned. They're not sure, or maybe even your doctor might not be sure. What if you're in your 40s and you exhibit signs of menopause? What if you're in your 50s and you still haven't gone through menopause, or you're not sure whether you are going through menopause or not, or you don't have the typical symptoms and now you want a blood test? Is there a blood test you can get done? Are there tests you can have done? What is typically the standard?
Here's an overview of an evaluation for menopause.
Your medical provider will also get a detailed history of your menopausal symptoms. Are you having hot flashes? Are you having depression? Are you having vaginal dryness? What are your symptoms? So along with getting your menstrual history, you'll also get your menopausal symptoms. Of course, consider your age, and all of those things will factor into what the evaluation will look like for you.
Assuming you've had a full history and physical, you've discussed your menopausal symptoms, you may have had a pelvic exam, what blood tests can be done to help diagnose or evaluate your menopausal symptoms? The first question is, are you over 45? Let's assume the answer is yes. Has it been 12 months since your last period? If you say yes, then you are in clinical menopause. Now, staying on that side, if you're over 45, but it has not been 12 months since your last period, no, then you're in menopausal transition. Now we're going to go to the right side. The first question again is, are you older than 45? So let's assume your answer is no, I am younger than 45. I'm younger than 45 and I have menopausal symptoms. So these are the labs that may be checked: your thyroid stimulating hormone, your prolactin level, and your follicular stimulating hormone. And then they will ask, are those normal? If they are normal and you are under 45, right, under 45, and those tests are all normal, then you are in early menopause. Okay, early menopause. However, if those tests above are abnormal, then further management to evaluate your thyroid and your hyperprolactinemia is needed.
It's also important to know that that evaluation might be very different if you have some special circumstances that might affect your menstrual cycle. So for example, women who have PCOS, polycystic ovary syndrome, they may have a very different menstrual cycle or very irregular menstrual cycle to begin with. So it makes it very difficult to determine when they're going through menopause, right? Or women who may have had a hysterectomy, or women who may have had breast cancer and had their ovaries removed. So there are a lot of different circumstances where it may make it difficult or a challenge to figure out whether the woman is actually currently going through menopause. And so the evaluation might be very different. Okay, finally, we're going to talk about symptoms of menopause, because so often people focus just on hot flashes. Meanwhile, menopause affects so many different organ systems in our body, and it's much more than hot flashes. So, the first symptom we're going to talk about is hot flashes. And when hot flashes happen at night, it's called night sweats. So for the women in the room who don't know what hot flashes feels like, hot flashes feels like unprovoked, a sudden heat that develops in the center of your chest area and seems to move upward across your face and then becomes generalized all over. So it's usually a feeling of sudden heat. You feel like you're about to start sweating and perspiring profusely afterwards because you feel hot internally. It may last 2 to 4 minutes, And hot flashes is something that may happen for years. It can happen for 1 to 2 years, or it can happen literally for up to 10, 20 years after your last period. I remember seeing my grandmother always complaining of hot flashes. She was well into her 60s, 70s, yeah, even in her 70s. I remember her complaining of hot flashes, and I used to think that was so odd. But in all honesty, women, even in their 70s, may go through hot flashes. So just pray that you are one of those women where it stops after about a year or 2. With the hot flashes, you might have a feeling of palpitations and anxiety, and also a feeling of shivering right afterwards. So it's not a comfortable thing to go through. So for the younger women in the room that may not have gone through menopause, or for the young men in their life who don't understand, just imagine sitting, minding your own business. Maybe you're sitting on the couch, maybe you're trying to go to sleep, and all of a sudden it just feels like you have an oven burning in your chest and in your body that you cannot turn off. And now you're sweating profusely, and you're looking around asking everybody, are you hot? Are you hot? Why am I the only person that's hot? That's what a hot flash feels like. For some women, it may cause absences from their job. For some women, it may cause diminished productivity at their job. It's a lot. It's a lot. And hopefully you are around people who are a little bit more understanding. Another symptom of menopause can be depression, right? There is an increased risk of depression during the menopausal period, or a worsening of depression and anxiety during the menopausal period. So be careful and make sure that you have a good medical provider or a good therapist and psychiatrist during this period. So for those of you that are related to a woman that may be going through menopause, you may notice a change in her mood, or a worsening in her anxiety and depression, or just a sense that she is not as happy and as confident as she used to be. So another significant symptom of menopause is sleep disturbance. And that makes sense, because if you're having hot flashes at night, or what we call night sweats, that may disrupt your sleep. But they also find that there are some women who are not having night sweats. They're not having hot flashes at night, but yet they find that their sleep seems to be very disrupted, or seems to be very inconsistent. They can't seem to rest well. And so obviously that's going to affect their mood the following day if they're not able to sleep well, because of, again, the sleep disturbance associated with perimenopause and menopause. Now you will notice I am mentioning these symptoms, but I am not giving you a treatment in this video, or I'm not giving you necessarily solutions, because the point of this video was to highlight some of the symptoms that are not always discussed associated with menopause, so that you don't feel like you're alone if you're going through some of these things, or you don't feel like you're crazy because you're going through these things and nobody else seems to get it. So that's why I'm sharing these symptoms with you. But in the next video, we'll talk specifically about some of the solutions or treatments that might be available for you. During perimenopause and menopause, you may experience cognitive changes. When I say cognitive changes, I mean like brain fog or forgetfulness. A lot of women complain that they are not as sharp, or that they don't feel that they are remembering, or that their recall is as strong as it used to be. It's interesting that both biologic and epidemiologic studies have shown that estrogen is important to women's cognitive health. There are studies that show women in their 40s tend to have better memory skills, or have sharper memory, than men the same age, but then after menopause, it seems to balance out. Or that women no longer seem to have the upper hand when it comes to memory when they go through menopause. So yeah, this is not for all women. This is for a lot of women that, again, complain of brain fog, memory concerns, just not feeling as sharp as they used to. Another major symptom, number 5, that we don't talk about a lot because women are embarrassed to talk about it with their doctors or with their medical providers, or just talk about it in general with anyone, is what is called the genitourinary syndrome of menopause. That's a long name, isn't it? Or a long term. But yes, also referred to in the past as vulvovaginal atrophy. So as you get older, for most women, not all women, but most women, you may find that the area down there starts to atrophy or shrink, right? It starts to shrink significantly. And so the area becomes less fluffy, for lack of a better term. It is not as elastic as it used to be. So as you get older and your estrogen diminishes significantly, you get vulvovaginal atrophy. And so the labia majora, labia minora, or the lips of the vagina, all start to atrophy, and the skin in that area becomes a lot thinner and less elastic, which means that sexual intercourse can be very uncomfortable or even painful for some women. The area may tear easily or bleed easily, and just overall uncomfortable. So that is a symptom of low estrogen and a symptom of menopause or perimenopause. Also affected is the clitoris and also the bladder. So you might find that you are urinating more frequently, or urinary frequency, or frequent urination, having to empty your bladder frequently, or you might also suffer from frequent urinary tract infections or frequent UTIs. So not only are there changes in the vagina, the labia minora, the labia majora, the clitoris, the urethra, the bladder, but you will also notice some changes in the dryness. You might find that that area is a lot more dry and also has a lot less lubrication, which, putting that all together, is a recipe for painful intercourse and a reason why some women going through this stage may avoid sexual intimacy or avoid sexual contact because it is just uncomfortable. And these changes, again, are due to less estrogen, but also due to less blood flow to that area. There is also the decreased or diminished libido for some women, a decreased interest in sexual activity or diminished arousal. For some women going through menopause, because again of the decreased amount of estrogen, they may find that they are not as interested in sexual activity. It does not interest them as much as it did in the past. And sometimes that change can be very emotional for some women to realize that they're not interested in sexual activity in the same way they were before. Along with that, another symptom some women may notice, that they cannot have orgasms as strong as they used to. Either they can no longer have orgasms like they used to, or that it is not as strong as it used to be because of menopause, and again because of all the hormonal changes. So if you are one of those women, I just want you to know that again, you are not alone. Just because the women around you may not be talking about it doesn't mean that they are not equally as affected as you are. And so it makes sense why a lot of women going through this period may suffer from intimacy issues, leading to relationship problems, leading to divorce, especially when you don't have a supportive and understanding spouse or partner. Joint pains. You may notice that when you're going through menopause or during this perimenopausal period, you have a lot more joint pains than you used to. As it turns out, they're finding that estrogen has a lot to do with protecting our bodies from inflammation. And so when you have a drastically low amount of estrogen or a drastic drop in estrogen, you may start to find that you are having aches and pains in places you didn't have before. You know, significant shoulder pains or significant pains in your finger joints or hip joints that you didn't have before. And that is definitely one of the symptoms of menopause. Now, of course, if it is very bothersome, or you suspect that it is a lot more than menopause, this is something you should discuss with your medical provider, because sometimes it might be more than menopause. Breast pain and tenderness can also be a symptom of menopause because of the fluctuating hormones in your body, fluctuating progesterone, fluctuating estrogen. But I say this with caution. The breast pain and tenderness I'm talking about feels hormonal, similar to when you are on your period or when you are about to have your period and your breasts feel tender and sensitive. That is the kind of discomfort I am talking about. If the breast tenderness does not appear to resolve, please see your medical provider and make sure that your mammograms are up to date and that your breast exam is up to date. Please see your medical provider. Don't ignore breast pain and just simply say, oh, it's due to menopause, I'm just not going to worry about it. That's not what I'm talking about, okay? But breast tenderness can be a symptom of menopause. Menstrual migraines, or migraines that cluster around the time that you would normally have your period. You might not be having a period now, or you've gone through or going through menopause. You're not having a period, but you seem to have headaches that cluster around the time you would normally have had your period. Those are called menstrual migraines. These other symptoms might be things that you may experience later. For example, osteoporosis. Osteoporosis or bone loss is something that you may experience due to the deficiency in estrogen. So estrogen deficiency as you get older can cause osteoporosis or osteopenia also. There are different degrees to bone loss, right? And so it may be osteopenia or it may be osteoporosis, but in any case, you will experience bone loss, especially during that first year after your last menstrual period. So definitely, again, discuss this with your provider and see whether you are appropriate for a DEXA scan to see how your bones are doing. Another very important symptom of menopause is your increased risk of cardiovascular disease. You can look up the SWAN study that was done years ago about how the risk of cardiovascular disease increases when women go through menopause. And some of that may be tied to your estrogen deficiency, which can affect your lipid profile or your cholesterol, and again, increase your risk for cardiovascular disease. Change in your body composition. You may notice that if you're going through perimenopause, that you appear to be gaining more weight around your midsection or around the gut, which is the most dangerous part actually to gain weight, right? Because it does increase your risk for heart disease. So yeah, it is definitely, unfortunately, a symptom also of menopause, gaining weight around the central area of your body. Most of us want to maintain our muscle mass and lose fat, but unfortunately, when you go through menopause, one of the symptoms you might find is that you're gaining weight, even though you don't believe you are eating more than you used to, that it is now twice as hard to lose weight than the past. Skin changes. You may notice when you go through menopause, specifically, there are significant skin changes due to a diminished amount of collagen. So when you go through menopause, it appears to coincide with a decreased amount of collagen, which makes your skin less elastic and more prone to wrinkles, which then makes you look older. So I think for many women, it's very important to start thinking about your skincare and what products you will use or how you will take care of your skin during this aging process. And you will also find that the layer of fat underneath your skin appears to be diminished. Balance. You might feel off balance. Impaired balance is one of the symptoms of menopause. You might find yourself feeling that you're not quite standing on steady ground, or you're more prone to falling and you just feel off balance. That is one of the symptoms of menopause, and it's not clear whether that is also just due to estrogen deficiency, but that is why it's so important as we are getting older, once you hit your 40s, to start incorporating weight-bearing exercises, as in weights, you know, even if you're using light weights. Now, I said I'm not going to talk about treatments and what you can do in this video. That is for the next video. All right, the next and final symptom I'm going to talk about is hair thinning. You may have noticed women, as they get older, that their hair becomes a lot thinner. They may have, you know, a similar male pattern baldness happening on the top, or thinning hair on the top, not just thinning hair on the hairline. Part of that is again due to the hormonal changes. As you have less estrogen, you start to have more of a dominance of testosterone, and this can be quite significant in some women more than others. And so that is why you will start to see thinning of hair in some women. Some women are blessed with thicker hair because of their genetics, and they may not see this significantly, but for a lot of women, thinning hair is something they deal with when they go through menopause. And again, it has to do with the less estrogen and the dominance of testosterone. So unfortunately for some women, they may have thinning of their hair while noticing more facial hair. So again, this is not all women, this is a lot of women. Anyway, I hope you got something out of this video. I really do. I feel like it's a very important video. It was something that took me a while to do. I've been thinking about it for a while, and it really felt very personal for me to want to discuss this subject, because I am a woman of a certain age and I am going through some changes, and some of it was kind of surprising and also really bothersome, and I just don't understand why there's so much shame associated with menopause or just getting older in general. I mean, it's really such a blessing to be able to have reached this point in our lives, and I think we should all be comfortable talking about some of these changes that we're experiencing, especially some of the ones that are very uncomfortable, you know. And I think it's important that we let those around us that we trust know what we're going through, especially our medical providers. So I hope this video has empowered you to talk to your doctor about some of these changes that you're going through, and also to understand that some of them are quite normal and it's not just in your head. And again, to recognize that menopause is not just about hot flashes. It can present as joint pain, you know, it can present as mood changes, it can present as vulvovaginal atrophy, it can present as depression, it can present as obesity, it can present as breast tenderness, it can present as hair loss, urinary frequency, or the bladder changes. I mean, it's a lot. It's a lot, honestly. Being a woman, it's a lot. And I hope you will share this video with the women out there in your circle. I hope that you will share this with a younger woman who may not have gone through menopause yet, but needs to know what is ahead. And like I said, come back for part 2. I will discuss some of the treatment options that are available for menopause, safety concerns, the special populations who may not be, you know, eligible for hormone replacement. Also, besides pharmaceutical drugs, what over-the-counter options are there that can help with menopausal symptoms, or what natural treatments are available, and also what things you can do without taking medications that may help some of these menopausal symptoms and help improve your life as a whole. So definitely come back for part 2. Anyway, thank you again for listening, and I will see you soon. I'd love to hear your opinion on this. I'd love to hear what you might be going through, or what solutions you may have that other women may benefit from. Okay? Bye. Bye.